Give it a second. There it goes. Okay. Good morning, everybody. Thanks for coming back. Did anybody go out last night and decide to do a night walk on the trail or anything? Look for more rattlesnakes? No. I want to just jump right into things this morning. So we're gonna get started with our first panel, and we're gonna be discussing recent findings in climate health. And but just real quick before we do that, I'm going to take a page out of Laverne's book in terms of the deep breath, and I think that that's a good way for us to start this morning. We've got the beautiful sun has risen. It's very dry and windy today, so those of you who came here to dry out from the rainy areas, you are getting your wish and then some. But let's just take 30 seconds and on your own, just take in some of those deep breaths. Just think about why you're here, about what's important. And for me, I'll share my gratitude that you're all here and that the sun is rising and that we have wonderful friends here to share with us their knowledge and expertise and experiences. Especially my friend Lori, who is going to be moderating our panel today. And deep breaths are good anytime, so take one whenever you need one. All right, Lori.
Y'all, welcome. I'm lucky enough to be able to introduce to you 3 tribal serving practitioners who are going to share their findings and observations that highlight the ways to adapt to the health and other impacts of climate change. We have Paula, who's new to my office, OEHA, Paula Andrea Torado Plazas. She's an environmental program manager and racial equity and justice person at OEHA, and really fun. She's also a great costume wearer and dressed up at Tribal EPA. If you missed it, you'll have to come next year. Next, Laverne Dementef, who's the chair and professor in the Department of Social Work, and also talked to us yesterday. I thought about what you talked about and fell asleep before 9 o'clock last night thinking about you. So thank you for that. That was wonderful. And Alicia Espinoza, Chief of Border Health at the Department of Public Health Services, County of San Diego. And I think I've seen you online, but never in the flesh. Welcome. And so I think, Paula, your presentation is first. Hopefully I don't have to touch anything.
Okay, so good morning, everyone, and apologies that I missed the fun introduction yesterday. I was coming from Sacramento, flying, driving, trying to make it here on time, so I apologize, but it's great to be here. It's an honor to be here. My name is Paula Torrado Plazas, and I'm the Racial Equity and Environmental Justice Program Manager at OEHA. Recently started in this role about 4 months ago, but before I was working for the environmental justice movement in Southern California, working directly with low-income and communities of color in South Los Angeles on community science, air monitoring, and other good stuff. So for today, I'll talk a little bit about our office, which is under the purview of the California Environmental Protection Agency, the Office of Environmental Health Hazard Assessment, and our mission is to conduct scientific evaluations that will help serve and inform regulatory actions and decision-making at the state level regarding environmental health issues at the state level. So we conduct the scientific backbone of evaluations that not only informs, but also gives us an assessment of whether we've been doing good or not. So what is the type of work that we do? So we conduct risk assessments, really trying to understand what are the different challenges that our state is facing from different realms, from different pathways, environmental pathways, water, exposure to toxic chemicals, air pollution, soil cleanups, and understanding what are the risks associated with the exposure to those chemicals in different environmental pathways, and coming up with health protective values, for example, for water advisory levels. We conduct place-based cumulative impacts assessments and environmental justice evaluations, climate change research. We also conduct epidemiological research and on health effects related to different environmental health challenges. Biomonitoring, which is this process of understanding how an exposure to a chemical is associated to a specific health outcome by conducting testing, for example, in urine or in looking at the hair. And there's different projects at OEHA that we have around biomonitoring that can help build the understanding of how a exposure to a chemical or exposure to a pollutant is associated with a health outcome. We also conduct pesticides community training, monitoring, and peer reviews. And we're also in charge of implementing Proposition 65, which is a proposition in California to create warning levels for toxic chemicals in products, in different products, or just different things, actually. So we are building the scientific force that supports decision making at the state level. And here are some examples of the work that we do. For example, one of the works that we're very proud of in terms of tribal engagement is the climate indicators report that I'll talk a little bit about it in a bit. Drinking water advisory levels. We also developed the California wildfire vulnerability, a statewide indicator evaluation around wildfire, pesticides monitoring, coronavirus screen, and other projects that are relevant to the state. So again, OEHA is building the scientific backbone to inform regulatory actions, but also give a retrospective of how we're doing in the state. So I'll talk about 4 programs that are very relevant to tribal engagement and are impacting tribal affairs. And so the first one is our climate change indicators report, and our fierce leader, Lori, has been leading this work for a long time. And so the climate indicators report, this is the 4th edition, and it was submitted, or it was published in 2022, and it has 41 indicators. It has 6 new ones. And in this new section, in this new climate indicators report, there's a specific section for tribal engagement around emerging climate change issues. So overall, the report is a snapshot in time. It's a retrospective assessment of how climate change has changed and has impacted the community all the way up until 2022. And so overall, it shows a continuation and acceleration of events or episodic events, how there's compounding impacts, and how there's fluctuations and variability in climate change effects. Some of the indicators are climate change drivers, how climate is changing, impacts on the physical systems, impacts on vegetation and wildfire, as well as impacts on human health. So more specifically to the tribal collaboration. So tribal voices are always at the forefront, leading this effort. And we recognize how tribal sovereignty and ownership has to always be respected, especially for when information is being shared and it's co-owned. And always looking and seeking for tribal permission as a priority and obtaining it first before sharing it or adding it to the report. So ensuring that the tribal members that were part of the development of these reports, their information is protected. And this is the first time for the climate change indicators report that tribes had direct access to writing chapters of the report. So this process really made it accessible for true collaboration, for engaging meaningfully with the tribe members that were part of this project. And it allowed us to incorporate indigenous knowledge into the report. So, oh, that's weird. These are some of the findings or the overall findings of the report in terms of tribal impacts and climate change. So, for example, how sea level rise has blocked or restricted access to traditional sites along the shoreline, which in turn or has also prevented the pass down of traditional knowledge because traditional sites have been restricted, or for example, materials or things that are used in traditional practices and cultural practices are no longer existent because of climate change, like wildfires are wiping out the materials that are used for basketry. So all of those things were taken into consideration to also share that in the findings. How cultural artifacts have been exposed due to sea level rise and coastal erosion. I already talked a little bit about how passing the traditional knowledge has been hampered given climate change impacts, and again, how nature has been impacted and the ability to pass down this knowledge has been hampered. And then lastly, how warming ocean temperatures and kelp forest has collapsed. So this effort really showed impressive impressive knowledge from the tribes, and so that's an effort that we're really proud of. So I'm gonna pass through these programs really quickly. So this is Cal Enviro Screen is another program. This is our environmental justice screening tool at the state level that uses indicators around population characteristics as well as exposure to different contaminants and pollution. And it creates a cumulative score, a cumulative burden score that helps us identify at the state level disadvantaged communities. So we use a cumulative impacts framework to develop Cal Enviro Screen, and it was published in 2021, the last version. So this is how we calculate the burden. We use pollution burden indicators like pesticide exposure, waste, particulate matter, and we multiply it by population characteristics like health effects like asthma, cardiovascular diseases, but at the same time other socioeconomic factors like housing, income, poverty, and employment to come up with a cumulative burden score that gives us the Cal Enviro Screen result. This is a cousin of the EJ screen at the national level. That is another environmental justice screening tool. And we use it to identify disadvantaged communities, which was a law that was passed back in 2015 around SB 535. So if a tribe wanted to be considered to be designated as a disadvantaged communities, they could come to us and we can help get that designation. The other project I wanted to talk about is the pesticides exposure engagement project. So with the pesticides engagement project, we have the goal is to train health professionals and around pesticides illness related to exposure. So we created a tribal engagement project. So this is a tribal council that informs us on how our educational materials can have more tribal knowledge and cultural practices. And so we invite you to come to us and get more information around that. The last one I will talk about is the fish advisories. So fish advisories is basically how you should eat fish and how you shouldn't eat fish, and if you should eat it, how much you should eat it. And so we have advisories that are related to tribes, so we can inform tribes that are near these water bodies so that they can have access to the fish advisory and learn more about how consumption of fish is for them. And this is an example of one that you can have access to, and you can come to us to get more information about that. And with that, I'll conclude my presentation, and thank you very much.
Hey, Doket Din. I'm so grateful to be here. Good morning. I wanted to just highlight that this particular presentation is something that I created as a social work educator and professor, working with students that are going out into the world, working with people in crisis, working with the world in crisis. Really wanted to support them in their efforts. And I realized that this actually crosses many, many spaces. And so maybe about 3 or 4 years ago, I had my my cousin and colleague, Melinda Chase, who works at the Alaska Climate Adaptation Center for the tribal part of that, she asked me to come, and she was doing a training with communities across Alaska focused around climate adaptation. And one of the things that she had highlighted was just a need to talk more about the trauma people were experiencing and the stress and the wellness and the resilience. And so I did, and I brought that in, and it seemed to be really well received. I wanted to highlight a couple of things about this particular training. I don't have a lot of time today, so I'm just going to quickly go through these slides, but this is always an opportunity. It's always an opportunity to practice, to think about strategies that we can do together. And I think, since I've been talking with people, I think this is really something probably all of you are interested in thinking about how to expand in the work that you do. So I always start with, how do we want to show up in this work? And it really kind of starts, and I usually do a meditation, which I won't have time to do right now, but really just thinking about, kind of getting grounded in how do we want to show up, right? What are the values that guide us in the work that we do? Why are we doing this work? Where's that passion, the fire coming from, right? All of that, and thinking about how do we want people to experience us in this work? And so that probably, is very specific to you, but may show up like, I want to feel joy. I want to feel connection. I want to feel like I'm helping. I want to be supported. I want to feel confident. I mean, whatever it is, how do we want to show up in this work? And how do we want to experience this work? But also, how do we want others to experience us in this work? And so I ask the question often, right? How do we want others to experience us? And we have to kind of start with intention. And you guys probably do this in multiple ways, but even just thinking about what are intentions as we do this work, right? And some of the guiding intentions that I have are that I want Indigenous cultural wisdom and practices to continue for another 10,000 years. So what I do now makes a difference. What we do now makes a difference. And I'm not going to go through all of these, but just thinking about what are the intentions that we have that can guide what we do. And I ask the question oftentimes, what gets in the way? What gets in the way of showing up as a whole, authentic, joyful, calm, creative, and collaborative person? And we all want to be in this space. And we get inundated by the stress of the world. So we have so much coming at us from just the crisis that the earth is in, but the crisis that we maybe work with communities, and they're feeling that grief and they're feeling the pain. And not only that, but then we have what we're hearing every day in the media around war and all of the things, right? So we have all of that coming at us, and so that toxic stress and unresolved trauma impact our ability to be in relationship, which is essential for collective decision making. So I think about, how do we want to be most effective? And when we're most effective, we are actually in our heart space and also in our thinking brain, right, our frontal cortex. But so much of that stress and that trauma, especially if we're bringing our own trauma to this space, actually creates this. It can put us into our emotional brain, right? Which is just kind of like this reaction and trying to just survive the day, getting to the night, right? Getting to the time where we can just go to sleep. If we practice these strategies, we can more collectively do our work at higher levels. It's pretty impressive. And I think we know this, but what I've been finding is that there's a gap. So we have what we know, and then there's the gap between what we know and what we do. And so I keep thinking about this gap because I think we as a society have so much knowledge, and we understand, and we even understand why this is important, but why we then we have to move to practicing it and doing it. But that doesn't always the case, right? We get busy and we get overwhelmed and we don't necessarily do that. I'm not going to be able to get into the stress and trauma, but if you haven't learned about ACEs, adverse childhood experiences, and how they impact our health across our lifetime, please do. This is going to help you in your work. It's going to help you understand how trauma impacts the body, mind, and brain and spirit, and why people do and behave the way that they do, right? So just a couple of comments. We talked about shaking yesterday. I told you I grew up in a home with alcoholism, right? When I was in my 20s, I would process with my siblings, and I have my parents had 10 children, so we would process about these things, about trauma and the things that we experienced, and I'd find myself shaking. But I would stifle it because I was embarrassed, and I wasn't sure why this was happening to me. Why was I shaking? And I didn't tell anybody. I just stifled it to the best of my ability, and not until I started doing trauma work did I realize that the processing that I was doing, my nervous system was releasing that energy. But by my trying to hold it in so much, was really causing it to stay stuck within me. So when we have these conversations out in the open, I didn't have to go through that alone. Actually, my brother really recently said, "Oh my gosh," because I just told him. And he's like, "I used to shake too, and I never understood why." So we're not alone in these things and the things that are happening around shame or pain or grief. But when we talk about them, we realize, okay, this is not something that's wrong with me, but it's something that when we understand, we can actually support, right? So again, I'm not going to go through too much of this, but recognizing that this concept of neuroception, our brain is always scanning for signs of either safety or harm. So we're always doing that everywhere we go, safety or harm. And if we're safe, we're kind of in our emotion, or in our thinking brain, in our heart space, and we can do work at higher levels. If we find harm, we immediately go into protective mode, right? We go into that space of, I need to fight or flee, or you're totally ramped up, and it's harder to think, it's harder to remember, it's harder to recall when you're in this space. Which is why we did, the whole breathing, and I talked about when you in your belly, breathing to your belly. That's part of engaging your parasympathetic nervous system, which is a rest and digest response. It seems really obviously we know how to breathe, but we don't breathe or practice breathing together, especially in times of crisis. So and again, how do we experience these things in our minds, body, and spirit? There's a whole field called somatic reactions or responses, and when we feel a lot of times grief, pain, anger, sometimes that actually shows up in our bodies as pain, as physical pain, as stomach aches, as a headache, as just tension. And so I think just recognizing, we were talking so much yesterday about the problems, which we needed to, right? We needed to kind of get grounded in this and understand it. But recognizing that if we're internalizing that, sometimes that shows up in our body in ways. So if you went home tonight and you were just a little, maybe your back was sore or something like that, sometimes you're holding that in different spaces in your body. So actually processing it, sharing it, releasing it, crying about it, walking in nature like we did, there's so many ways to release, but I think that's what we can do as a collective. We can strategically place these practices within our organizations and in our communities so that we can work on them together, because sometimes it's hard individually to actually do that. We may feel like, I don't remember exactly how this works, or I just don't have time, or I forget to do it, but it's because we don't have a culture of it right now. I wanted to just share, as we move into trauma-informed care or healing, that I think we have to again recognize that we're not alone in these feelings of solastalgia, which is climate-related grief, and that we have strategies. Our ancestors had strategies, right? So I wanted to. There's actually code was maybe it's on the next one. Oh yeah. Okay. Oh, okay. That's all right. So, so I do have a code on here for if you want this handout, but So what I've learned over time from elders, as I've talked with them in my research and just in my relationships, the things that have rose to the top in terms of thinking about how to engage in a good way have been around compassion, the 5 C's: compassion, connection, community, curiosity, ceremony. And so I'm not going to be able to go through all of these, but I just want to give you an example out of each of them, right? So I work in individuals, institutions. My uncle came to me about 10 years ago. He was like, I'm worried about you. When you're in institutions, you're often walking around in your head space. You're thinking about and planning for the future, your deadlines, you're constantly here is like, what do I have to do? And that can cause you to miss a lot of what your body's experiencing. I'm thirsty, I'm tired, whatever it is, right? And so missing those things and pushing through them sometimes can create illness or cause illness. So he said, I want you to practice. He was worried about me again. So he wanted me to practice moving from my head to my heart every single day. And this is probably the best advice that I've been given ever, honestly. I started doing that. My connection with colleagues and students grows so much, my compassion for myself, right? Moving from my head to my heart. And if you think about like even just putting your hand on your heart space, taking a deep breath, if you do that just for 30 seconds, the energy starts moving. The energy will start moving around your heart space. You're going to come down from your head back into your body, start feeling things in your body that you can then release. That's one practice. Connection, challenges, challenges basically, life is full of challenges that disconnect us. So we have to think about how do we connect back up to ourselves, to each other, to family. All of the things that elders teach us are so powerful. And community, we learn so much in community. My whole goal is to create a community of care and community of practice in the work that we do. And that is in every setting, and it works in every setting. Curiosity is just learning more about stress and trauma and healing and cultural practices. And then ceremony is something that has kept us here for thousands and thousands and thousands of years because it brings us back into balance, back into connection with spirit and nature and land and each other. And so ceremony belongs in the work that we do too. And I'm going to stop here, but there is a QR code that has a slide that shows all of these things. And Doget Den, thank you so much.
Everyone, thank you so much for having me. I'm so glad that I went last because I felt like I dropped my kids. The girls had nightmares, so we sleep piled last night. So it really just allowed me to kind of shift my energy. Really appreciate it. So my name is Alicia Espinosa. I'm with the County of San Diego. I'm the Chief of the Office of Border Health. I've been in this role for about a year. Previous to that, I have 15 years, all of my work experience has been in nonprofits, so in the community. And I really appreciate that because I think I bring a different lens that I try to incorporate in all of my work and all of my conversations. Need to get closer? Is that there? Wow, what a difference. Okay, thank you. So that's kind of my background. And so I'm going to talk to you today about the Partner Relay Communication Network. I'm going to try to go quickly. We have a lot of slides. So this is a little bit about our San Diego County community. And I don't want to go too much into it, but the main point is that we have a really diverse and enrichful, not only diverse populations, but diverse landscapes. We're within an hour to two from the desert, from the mountains, from snow, from water. And then our region really is no strangers to the diversity of natural disasters. So it's not a matter of if, it's really a matter of when. And so what I want to share to you is how we can duplicate this model that we've created into various different communities and adapt it to your own community by understanding what your landscapes are, what your cultural values are, what your communities look like. And how this all got started is that we implemented a vision of living well, which is building better health, living safely, and thriving. And we kind of live in the world of living safely. How do we become more resilient and be able to prepare? Instead of reacting, how can we be prepared for an emergency and be able to respond correctly? And so similar to the model, it's really, it's a socio-ecological model. And so we understand that we're impacted at many different levels, right? Our interpersonal, our intrapersonal, institutional, community, policy. And to be most effective, we want to reach the individual at all of these levels. So then how do we partner with different stakeholders that are at all of these levels so that we can make the most impact? And so the Partner Relay is an initiative to improve communication with limited English proficiency communities during natural disasters and public health emergencies. It's a community collaboration coordinated by the Office of Border Health and then the Office of Emergency Services. So I don't know if many of you have ever heard of the CURB model, CURB effect, but basically in public health, it's where they designated the curbs so that people with disabilities are able to come onto the curbs easier and be able to, not struggle in that aspect. But what we learned is that it also impacted mothers, people carrying strollers, people with carts, and so the benefits were greater than what was initially started. And so the focus is if we can reach our most vulnerable populations, then there's other populations that are also going to be impacted in, for example, our elderly community, children, people with disabilities. And so now we're really trying to look at, is limited English proficiency communities the best term, or should it be access to functional needs, or should it be a different term so that we're reaching more when a disaster would strike? And so our partnership with the Office of Emergency Service, obviously they create and push out any disaster messages. And so each county or state might have a different department that they're receiving messages from that are vetted messaging during an emergency. They also share resources, develop plans and procedures, and there is a whole gamut of just a ton of resources. So we really rely on them for the emergency information, but then we take that information through our Partner Relay network and then push it out to the communities through the methods that is previously used to be Slack, and now we've learned that that didn't work so well. So maybe we should, what works best? And they're like, well, we like emails, we don't need another tool to go to if we're already here in one space. So we're learning now how can we adapt our model to best reach the populations. So a little bit about the history. In 2013, there was a community forum to seek input on how we could better prevent and reach populations with emergency information. And this was right after the blackouts that took place. Another example is that we learned that there are varying degrees of government trust, rightfully so. So then how do we reach the populations that we need to reach, knowing that there's varying levels of trust within the government? And so what the recommendation is utilize existing networks to develop a partner relay. So what does that look like? It's who are the community organizations that are trusted in the community, which clinics are trusted, which nonprofits are trusted that already have those relationships, so that if an emergency strikes, we have this network where we push out the information, they receive that message, and then they distribute it to the communities in the way that works best for them. So some people might receive a text message, some people might receive a phone call, and so it just, each kind of partner knows how to best reach their community, so we kind of provide them the information and then they relay that information. And so we did a series of feedback sessions to try to see what is the best platform. At that time, we identified Slack. Now we're shifting from Slack to an Engage page. So all of our partners can have access to that website. They'll receive information. They could give us feedback on what they're seeing. So maybe we have a connection with an elderly center and they're saying, hey, this community doesn't have access to radio or phones, so we need someone to go there and get that information to them. And so then that way we're able to relay that message with maybe Office of Emergency Services and then distribute that information to that community. So we're still now COVID taught us that we kind of put everyone in our list and try to reach everyone. Now we're like, okay, how do we scale back and see which partners are really active? How do we continue from square one, creating these community forums, having these discussions again, and seeing what can we adapt and learn from what we've received to this point. The list right now is at about 350 individual partners, and then they're all part of about 700 community organizations. But realistically, we understand that there's a whole other population that we're not reaching. There's a migrant community, there's a refugee community, and that's specific to our county. So we're trying to expand and see how we can get the populations that need to receive the messages into the Partner Relay network so that nobody gets missed and the messages get to who they need to get to. So we have 4 main objectives. It's providing county incident information during natural disasters or public health emergencies. We do have quarterly emergency preparedness and then public health trainings every quarter for our partners. Sometimes that might even look like a partner organization that's presenting their resources so that people in the distribution list have an awareness of maybe something that they didn't have that's accessible to the community. We do conduct emergency drills on an annual or biannual to try to practice that information, and we have mock scenarios so that if this happened, you know, what would we do next? Who's really tuning into the network? Is it working? What can we improve on? And then 4 is just to create that network of trusted community stakeholders so that we could share information into various languages with different communities. So here's a little bit of our partners and stakeholders. Give you an idea. I won't go through each one, but there. Here's the Engage page that we switched from the Slack platform. This should be launching by the end of this year. We're excited about it. We're going to have a test run with a few partners in the next couple of weeks here just to see if there's certain things that we can modify. One of the big things for us is translation. And so I know that now the Google button is a lot better than it was before for translate. So how can we maybe have a message that could just be copied and pasted into that other language so that the communities can then take that and then disseminate it? So we're still kind of working through some kinks, but we're really excited to be able to adapt it. And so there are different tools and resources. There's a personal disaster plan. It's also downloadable and it's free. There's the SD Emergency app. I love this app because you can also build your toolkit and kind of create your own family emergency plan, which I did a training through CERT, and it was only a half-day, one-day training. I hear these trainings are pretty intensive, but it just made me realize that we don't have a communication plan. If something happens, how am I going to get to my mother-in-law? How is she going to get to us? Who's going to pick up the kids? And if I'm working in downtown and my husband in San Marcos, how are we going to coordinate this? Where are we going to meet? Do we even have water available? Do we have a go-to kit? We didn't have anything, nothing. And I'm like, oh my God, we're not ready. Like, we're so ill-prepared. And so then I've slowly started like, okay, let's try to do little by little because, you know, to be on a budget, we have other finances going on. So how can we slowly start to build our plan, build our to-go bags, just making sure that no one is forgotten if an emergency does strike. So some of the tools and resources, these are also, I think, in the books. It's the CDC's Access and Functional Needs Toolkit. This is kind of what I was telling you, where we originally started for limited English proficiency communities, but then we realized, well, if we focus on this, these other factors also are a priority. So we're considering expanding the name so that we're really reaching any vulnerable population that needs to be able to move during a disaster. There's also the whole community approach to emergency management through FEMA, and it's really working on leveraging and strengthening those existing social structures. So how do we work with what we already have? You know, maybe we can't get to a certain part of the community, but maybe there's a partner that's already there that's doing great work, and we can use that partnership to be able to leverage messaging and reach those populations. And so here are our partner relay liaisons, Victor Ruiz and Juliana Vicenia. They get all of the credit for this work. They're out in the community, they're talking to partners, they're doing everything that has to be done so that we can try to create a healthy and enrichful partner network to be able to ensure that no one is missed during an emergency. Resources, which should also be in the booklet. I've not been paying attention to my time. Okay, good. And that's it. Thank you.
That was cool. It was a digital community of care is what I saw in that. If anyone has questions, we have mics and we'll run mics around to you. You can wave or holler. Mic runner coming.
Hello? Here you go. As you can tell, I'm not a rock star. Okay, so last week I read a journal out of public health that California is experiencing an increase in valley fever. That's what's happening? It is also happening in Arizona as well. So some of the scientists are saying it's because of the dryness of the soil, and then the wind's picking it up and throwing it in the atmosphere. So is that true? There is an increase? Okay.
Yeah, yes, there is. We've seen it in California as well, and is one of the indicators that's associated with drought,
Okay.
just as you explained it, Soso.
All right, thank you.
No, I think you answered it, but yes, the answer is that yes, there is. And I have my family resides in Bakersfield, and so they, depending on how much dirt you have or where you are, it does affect you more. And so, just being mindful of knowing that information, and then what can you do, as we've learned today, to take those preventative steps so that our, most vulnerable children, elderly, can take those steps to counter that.
I just wanted to say that, also just being mindful about stress. And when we are feeling stress just from our lives and our relationships or finances, that exacerbates what's happening, right? So the more that we can practice strategies to take deep breaths and to restore all of that, that's going to help with some of the things that we're experiencing, like valley fever. Yeah.
Thank you. Thanks for your talks. I have a question for Laverne. I heard you say that the Climate Adaptation Center was identified a need for more discussion around stress and trauma, and I was wondering if you could elaborate on maybe how that's played out in their work.
Yeah, actually, Shasta came up too, and we did a presentation for tribes focused around this. And that, I think that, I don't even know, maybe it was my first training with them was about 5 years ago, and they had done a lot of different data gathering from what tribes were doing and the needs. And one of the things that rose to the top was around wellness and trauma. And but they'd realized that people weren't incorporating that necessarily into adaptation planning in a larger way, maybe in some specific ways. But so they invited me to train on it and just have conversations. And I think it's just been really well received. I think people are realizing, there's so much happening in the community, from politics to just the things that are happening from grief, death, and just the challenges of just living, and then to do this work on top of it, and trying to engage and collaborate and recognizing, in order to move a whole community, you really all have to come together and be able to communicate and engage and stay engaged even when it's hard, and that's challenging for anyone. And so the more that we can have conversations about what this looks like, the more tools that we have to be able to stay engaged and do the work.
Mike, did I see your hand up? No? Oh, it was Dennis.
Good.
I was just curious on, you're talking about your meetings and I guess getting the targeted people to the meetings. How do you conduct outreach to get the right people to the table?
I think for OEHA, the way we've done it is to get out there, to leverage our existing relationships that we have with tribes, being intentional about how we approach tribes for the work that we do, but also not with this approach of us being a go for for. I tried. A go-to person, so that we can serve the needs of the tribes and shifting the narrative to be in this mutual collaborative approach to the work in a way that we are serving the needs of the tribes, acting as a listener, as an active collaborator. And I think that that's what helps our outreach, and centering and not utilizing the traditional knowledge, but amplifying it, uplifting it, and making sure that that's centering the work that we do. I think that that's the best way to conduct outreach for tribal engagement.
Any other questions? Shesta.
So I was really happy to be able to include, of course, all of you, but Alicia and Paula, since you're in California, and we've got folks here from lots of different parts of the country, I was hoping you could talk a little bit about what your thoughts are for expanding programs like this in other regions, and maybe you already know of some other states that are doing similar things or other counties that are doing similar things, but what would be your recommendations for the folks in the room for being able to start something like this in their own communities, whether it's their tribal community or going out to their county or their state?
Yeah. Yes. Hello. Okay. So this partner relay network has been duplicated in the state of Michigan. I don't know how successful it's been. I know that my predecessor and other colleagues, when they're ever at conferences, people always go, "Oh, the San Diego model." I'm like, okay, cool, we're doing something right. But really, we're trying to create a toolkit that could be shared, and so that it could be applicable to different communities, right? And so within the tribal community, it's knowing, who is within your outskirts, who is within those kind of smaller siloed communities. How do we reach those people that maybe not are always connected? So again, just always trying to form those connections, that web, so that it's in place. And then if it's partnering with like your local, for us, it's Office of Emergency Services. I'm not sure who it might reflect like or look like in a different county, but figuring out who that person is and then starting that relationship and connection. Most times during what I've learned is people during emergency preparedness, they want to be able to connect. They want to make sure that no one's left out. So it's reaching out and kind of building that network and that relationship, and then going from there to see all of the tools are available. So you could even be like, hey, which was literally done for me in a different project called Love Your Heart. Somebody was like, this county is doing this great model. Here's a toolkit. Check it out. How can we modify and implement it? So kind of taking the resources you have here and then start knocking on doors, emailing, calling. How do we do this? How do we start this? Most times people will want to do it if it's benefiting the public and the community. And so.
Yeah, I agree, Alicia. I think another thing is creating and building a strong platform for engagement. So having a strong understanding of what you're going to do with tribal data sovereignty, with ownership. How are you going to approach power dynamics, and understanding that your expertise is valuable, it's important for the work, and centering your understanding of what you want to do and have a vision for it. So for example, for the climate change indicators, it was really important to amplify the voices of the tribal members at the same time as creating space for amplifying their knowledge in the climate indicators report. So finding this mutual collaborative approach, it's important. I think that having that as a go-to first step, it's important. So again, creating strong platforms for engagement, having strong understanding of the roles of how we're showing up, and creating space for amplifying expertise, it's important. And that would be the first step, I think, in trying to develop a collaborative approach with an agency or a county or a city government and tribal members, so that that's understood from the beginning and that's respected.
And on a data level, everything at OEHA that, at least that I've touched, the data is documented and downloadable. So you can just steal the outline and use it. I worked with Department of Public Health in Minnesota to do just that. Alicia, I had a question about tribes setting up a relay network hub, for lack of a better. Is that something that you guys would be open to?
Absolutely. Yeah, anyone. I think for me, it's like, how do we make sure no one's left out and there's, again, my community lens bringing into my county lens. So there's a saying that nothing for us without us, right? And so how do we work collaboratively, mutual respect, and then really just the resources are free, borrow them, take them.
And my other question along that line, I'm a linguist by education. Is this something that you could do these alerts in both English and an indigenous language and any language? Or is it a pick list of languages like Tagalog and
So right now for the County of San Diego, it's in the 8 threshold languages. And then, so I totally missed something in the presentation. We have something that we called a smaller, like a subcommittee of the larger network, which are our language champions. And so these different, NGOs or community partners are able to translate the message in the community language that they serve if we don't have it within our 8 threshold languages. And so then we'll rely on them. They'll translate the message and then we can post it because we know that there's other communities that might be beneficial for that. So we would love to partner because we don't have that yet.
Thank you very much. And Laverne, I was really interested when you were talking about the gap between knowing and doing. Can you go more into that, please?
Yeah, that I think that's the thing, right? So I think that's what we want to know more. How do we help get people engaged? People know why this is important, what it is, and a lot of times, but then to actually take action is a different story. And I think part of it is just understanding the culture we're in. So how that's impacted us, right? Just how busy we are and inundated we are in this world, this hustle culture that we are living in. And I think that helping people understand how that impacts them, right? And so we were having this great conversation about rest and restoration yesterday, and thinking about, I read this book, Rest is Resistance by Tricia Hersey, and she's an African-American woman talking about how her ancestors were enslaved and didn't get an opportunity to rest, and that has come through in her life. And so she had to really begin to explore what that meant for her in terms of colonization and capitalism. Anyway, so really beginning to understand what are the challenges within that gap, but also recognizing we have strategies and so building a community of care is so important in our work. And that's the community of care and the community of practice. The community of practice really is that, how do we do this together? So if you think about something like self-care, right? It's very individual focused. It's actually a very privileged concept because not everybody has access to running water for a bubble bath. Not everybody has money for a gym membership, right? Or access to fresh vegetables and foods. So thinking about it as self-care as very contextual, what do we have right around us that can support and nourish us and help us restore? There's a really great Indigenous scholar in Canada, Natalie Clark. She says, let's practice self-care, but let's also think about community care. So that really is, I think, what I've been hearing a lot in this conference is the we, right? How do we do this together? How do we engage in this work together? How do we practice these skills together? And that's what's going to, I think, move us forward. So it's about community of practice, community of care, and a community of practice in that space. So, Dokeden.
Rest is resistance. I'm gonna have to read that book. That sounds great. And finally, Paula, on the fish advisories for California tribes, how if your species, the species your tribe eats, isn't on one of our fish advisories or a water body isn't there, is that just tough luck, or is anything we can do about that?
I think they can reach out to us and we can they can reach out to us and we can figure out how we can conduct the assessment and prioritize it. I think we're trying to also shift to have tribal specific fish advisories that include culturally appropriate language around fish consumption. But their straight up answer is to say, reach out to us and we can create those fish advisories that are more specific to your tribes and to your needs in terms of fish consumption.
Thanks very much, all of you. It was really wonderful. Oh, wait, there's Celso's. Celso's got a question. Sorry. There we go.
I wanted to, I work with a lot of youth from middle school to college. And in the college students, we talked about historical trauma. Historical trauma being what we went through. And most people, all people went through historical trauma in the world. I mean, we're not the only ones. But one of the things that came out of the discussion with some of the graduate students is that we are now experience trauma, different forms like drug addiction, not just tribal, but everybody. This world that we live in has a lot of trauma. And so one of the graduate students was doing his PhD on psychology. He said that we are experiencing historical trauma right now because of climate change. People in the future are going to say, you went through historical trauma, climate change. And so all of us, the world right now, finally we're all unified in one thought, and that is being traumatized by climate change. The Intergovernment Panel on Climate Change said that was one of the things that they're looking is the mental health of the world, because we all are suffering at different levels of trauma that are occurring now. So I thought that, have you heard that concept? I think.
Yeah, absolutely. Oh gosh, there's so much to that. All cultures have experienced historical trauma. And I think that in the mental health social work field, where we're talking about trauma-informed care or healing-centered care now, which is a recognition that this trauma is widespread. And that if we know that, then how we engage and act has to be different, because if we are, creating spaces that are unsafe and people get triggered, they just can't hear. They can't hear you. They can't remember. They can't recall because they're in that space of fear and anxiety, right? So how do we come out of that? And so that's the strategies we're all talking about. But if we understand exactly what you said, then there are strategies to shift our behavior so people can actually come to a place where they can hear you, understand, remember, and engage in that relationship in a more effective way. So it's so right now, it's so important. Thank you so much for sharing that. I work with elders who have, we do a lot of listening sessions with elders. And one of the things at Danakanaga, it's our partner, one of our partner organizations, it's the elders in the interior of Alaska. And we asked them what their priorities were. And they said they wanted to create an elders mentoring elders camp because the elders of today are struggling to step into their role as elders because of the boarding school experience. And so they wanted to create a space that was non-judgmental, because when someone asks us, do you know your language or do you know your tradition, and you have to say no, there's pain associated with that and grief, and it's even a trigger, right? And so they were like, we need to create space where people can come and actually have conversations, heal together, learn some of the things, and and then work on sharing them back out, because that's how our culture continues into the future. So really beautiful, powerful elders we have that know what we need to. So, listening to them is good.